Okay, this video is about the Pritikin papers, and I'm talking about this one paper, Pritikin. You'll find it by going to the drmcdougall.com website, and then you want to click on you just type in Pritikin's name, search for Pritikin. This page will come up, a review of the medical literature, but you don't want to go to that book at this time. You want to go to the February 2013 newsletter, and once you go to that, you just go down to the references at the bottom, and you'll see this Pritikin paper, and here it is. It's from the Journal of Applied Nutrition, winter 1976, High Carbohydrate Diets, Maligned and Misunderstood. Okay, by Nathan Pritikin when he was living in Santa Barbara. And here's why it's such a great paper, because Nathan Pritikin was very good about going through the literature in a thorough way to make a convincing point. So the point of this paper is that high-fat diets are bad. Fat is bad. The high-carbohydrate diets are by far the best. Okay, and so here's what he says. It is my position that the key characteristics of an optimal diet are very low in fat. Very low in fat. I tell you that because there's a movement afoot, I think, to actually get rid of Dr. McDougall's legacy and to get rid of, people like Pritikin and Kempner and whatnot. And I'm trying to tell you, the real data shows that these very low-fat diets, and when I say very low-fat diets, I mean 10% or less, they're the ones that have been shown to reverse coronary artery disease and have all these dramatic benefits. Okay, and Pritikin went through the literature in great detail. First of all, he talks about the Bantus in South Africa. So those are the Africans who were eating a diet of 10% fat, and their incidence of coronary heart disease was almost zero. There was an autopsy study, and they found no deaths ascribed to coronary heart disease. Another one compared 42 Bantus, 22 Europeans who died suddenly. Only one Bantu had atherosclerosis, whereas 100% of the Europeans, even a 15-year-old, had extensive arterial damage from atherosclerosis. Here he then looks at the New Guinea population, who was eating, he says, 10% fat. Actually, New Guinea population is eating less than that because they used to eat 93% of their calories from sweet potatoes, and they only have 1% of calories from fat. Okay, autopsies performed on 600 natives of New Guinea showed that there was only one case of death attributable to coronary heart disease. Blood pressure in the New Guinea natives was found to not rise with increasing age, and even the diastolic, when people were in their 60s, dropped by 10 millimeters Hg. Okay, then he talks about the Ecuador population. This area in Ecuador had an unusual number of people markedly aged, many over 100 years of age, and they had good old Catholic Church records that confirmed these ages. And they said cardiovascular disease was essentially non-existent. The diet was mostly complex carbohydrates, corn, brown rice, beans, other vegetables, and fruits. And they had tiny amount of animal protein once a week. Okay, and Pritikin thought people could eat a little bit of animal protein. He thought they needed it for B12, but you don't need it for B12 anymore. And I think it's best, McDougall agrees, to just be done with it. So you don't think about it, you don't bother with it at all. And T. Colin Campbell would agree with that. You minimize cancer risk by avoiding all animal protein. Okay, continuing with the paper. Ansel Keys studied over 25 populations. Okay, that's a lot of populations. 25 populations. And without exception, their heart disease rate was low. So the ones who ate a low-fat diet in 25 consecutive populations, all of them had a very low rate of heart disease. Japanese populations who migrate first to Hawaii, then to the USA, the more they westernize their diet, meaning the higher their fat intake, the more they will get coronary heart disease. Nathan Pritikin basically says all these so-called degenerative diseases or so-called Western diseases, it's all the same thing. He says they're all prevented or cured by a low-fat diet because they're all caused by a high-fat diet. He says when you say degenerative disease, what you really mean is Western disease caused by a high-fat diet. Pritikin would also say the way you divide diets is by the amount of fat. So basically, the school of diet that I recommend based on my extensive experience studying the subject and my personal experience and my patient experience is a very low-fat diet, meaning 10% or less of calories from fat. The most popular vegan diet amongst the so-called experts is what I would call moderate fat. And that'll probably be in the ballpark of about 15 to 30% with all these high-fat foods mixed in there, which I'm not a fan of, soy and nuts and seeds and omega-3 and avocados and all this other stuff. I personally think it's best to avoid all that stuff. And then the more animal foods you bring in there, the higher the fat's going to go. And I personally recommend to avoid all that stuff. Okay, let's continue with this paper here. Now, this is Nathan Pritikin's work himself in his clinic area, let's say out of Santa Barbara. He had a bunch of patients who had terrible atherosclerotic disease, peripheral vascular disease, PVD. And 38 men, average age of 60 years of age. Their arterial stenoses, narrowings, were so bad they could only walk a few minutes on a slow treadmill because of calf pain. That's claudication. They had coexisting all the usual suspects: obesity, hypertension, diabetes, angina, cerebral ischemia, etc. Their average cholesterol levels were between 200 and 300. When he put them on a low-fat diet, 10% or less, they made dramatic improvements. He just put them on the same type of diets that populations all over the world eat who don't have atherosclerosis, meaning about 80% carbohydrate, 10% or less fat, 10% or less protein. And all whole foods, none of these refined foods. In the first 2 weeks, blood cholesterol dropped an average of 30%. One patient's triglycerides dropped from 360 to 85. And his goal was to try to keep total cholesterol below 130. That's incredibly low. The Framingham study, Esselstyn, just tried to be 150 or less. Okay? And he wanted their triglycerides below 75. By the way, I just checked my total cholesterol last week, and I had a total cholesterol of 144, and I had a triglycerides of 61. Usually my total cholesterol is lower. It bounces anywhere from 90 to that's about as high as it's ever been at 144. Okay, he also talked about some other populations, a little more on New Guinea. They typically have a total cholesterol of around 100. They're the ones that eat most of their calories, 92% from sweet potatoes. And they had a total cholesterol average of 100. The Bantus in Africa had a total cholesterol average of 90 to 120. The Ecuador population with virtually no atherosclerosis had a total cholesterol average of about 150. It's been said if you can keep it below 150 just based on diet, you're unlikely to get atherosclerosis, coronary artery disease. Ansel Keys found that the low blood cholesterol levels, that the populations in all 25 of the areas who had low-fat diets and very low incidence of atherosclerosis, coronary atherosclerosis, they all had low blood cholesterol levels. Okay. Let's see. After 5 weeks, they were also exercising on the treadmill. Nathan Pritikin's patients in Santa Barbara, they increased their treadmill performance by 800%. So if they could walk only 1 block, they then were able to walk 8 blocks. That's a dramatic improvement. Usually those patients never get better. They just do a surgical bypass, angioplasty, stents, thrombolysis, and they keep slowly getting worse. A lot of them die of myocardial infarctions. Yeah, peripheral vascular disease means you've also got coronary artery disease and cerebral vascular disease. He also noticed that they had incredible drops in their blood pressure. 9 out of 9 got off all their medicines pretty fast in 1 month. He mentioned Nathan Pritikin in his experience in Santa Barbara with his nutrition clinic. 85% of his hypertensive patients would come off all their medicines. That was pretty routine. McDougall said in his experience he gets about typically 90% of his patients off all their high blood pressure meds, which is a good thing. You don't want to be on high blood pressure meds because it's dropping blood flow to the Johnson. They're very often impotent. It could drop blood flow to the cerebral cortex on top of the brain, leading to cognitive impairment and dementia. Okay, he also talked, some of his patients had been on antihypertensive drugs for 20 years and they came off all of them. He had great things also happening in Pritikin's diabetic patients. In this particular study, some of the diabetics were off all their drugs in 6 weeks, and this includes some who had been on insulin for 10 to 15 years. So if you get the patients to dramatically drop their body weight, let's say lose 30 pounds, and you switch them to better diet. Roy Taylor's shown that he got 100% of diabetics who had only had type 2 diabetes 4 years or less off all their pills. J. Shirley Sweeney, the 1927 study with medical students showed that if you fed them a high-fat diet, they'd all fail their oral glucose tolerance test, become diabetic. You feed them the high-carbohydrate diet, they all passed it. They didn't become diabetic. This guy Anderson did a similar study. You put them on a low-fat diet, and they don't get diabetic. You put them on a high-fat diet, they become diabetic. Because high-fat diets cause insulin resistance, leading to diabetes. And the patients who stayed on that low-fat diet for additional 7 weeks, they all continue to not become diabetic, to pass their oral glucose tolerance test. However, if you put them on, and these are included patients eating simple sugars like sucrose, white table sugar. Table sugar is half glucose, half fructose. That's what sucrose is. Whereas if you eat a parch, it's a polymer of glucose. You're going to have more fructose when you're eating table sugar. Okay, and that can drive up your triglycerides. I don't add any sugar to my food, and like I said, my triglycerides were 61. And I eat a lot of rice, but it's glucose. Okay, this guy Singh had a diet of 12% fat, and he had also incredible results with his diabetics. 80% of them came off their, even though starting with 80, he started with 80 insulin-dependent diabetics, 72% were, in 5 months, came off all their medicines. Several had been but there were some patients who didn't. And I think the ones who are not, once you lose all your beta cells, the pancreatic cells that make insulin, then you're not going to be able to escape from being insulin dependent. And Nathan Pritikin also, I've listened to some of his books and his lectures. He had all these patients who they would reverse their lower extremity arteriograms, their coronary artery catheter angiograms, just like Esselstyn later showed. He talks about the Framingham study, where the persons who had total cholesterol levels of 260 and above had 4 times the risk of cardiovascular events than the ones who were at 220 or below. So total cholesterol makes a giant, tremendous, it has a direct correlation with atherosclerosis, coronary artery disease, myocardial infarction risk. And the reason is because it sticks the red blood cells together, thus overcoming the zeta potential, thus making the blood more prone to clotting. Plus, these are people eating higher fat diets, more animal protein. They're also going to be likely more prone to leaky gut with all the amyloid clotting that goes with that. Ansel Keys' study in Minnesota started in 1947, confirmed the results of the Framingham study. Patients who had maximum total cholesterol 200, so 200 or less, in comparison with those of 220 to 240, were found to have 2.5 times less heart disease. Okay, all major population studies provide evidence of the correlation between cholesterol level and heart deaths. Another researcher, Welch, did angiographic studies of 723 men who were less than 40 years of age. Half had 2 main coronary arteries or more closed, and the relationship about the amount of arterial closure to total cholesterol level was identical, essentially identical to that of the Keys, Minnesota study. Cholesterol levels of 250 or more had closed arteries, had 3 times as much closed arteries as those with total cholesterol levels of less than 200. So it's totally useful and it's totally valid, and you should want to know that. Anybody who tells you otherwise on the internet, they're BSing you. And this is like McDougall had said. McDougall had said a lot of people challenge him on nutrition, and no one should challenge him on nutrition unless they've at least read Kempner and read Pritikin. And I would agree with that. You really can't have a sense of the history of nutrition unless you know about Kempner and Pritikin. And Pritikin did a fantastic job of summarizing all this research. He summarizes it in his books. He's summarizing it in this paper. In his books, he goes into more detail. It's nice because he's got all the references too, so you can see all this stuff. So that's the end of part 1 of the Pritikin papers. I'm going to continue on with at least a part 2, maybe a part 3 on this paper.